We're speaking with Marian Robinson, Community Liaison at the College of Health Education and Human Development at Clemson University. Marian participates as an advocate with the AACR Scientist-Survivor program. Thank you for joining us.
You're welcome.
What are some challenges in your area of South Carolina regarding disparities?
There was a question that came up earlier in one of our sessions that discussed what health disparities are. And over the years, almost 14 now that I've been working with cancer disparities, there's different definitions. And I think it fits appropriately during the time or the area of which the question is being asked or the problem is being addressed as to where disparities fit in. Disparities in South Carolina right now definitely are the economy. I think South Carolina may be, it's ranked pretty high, and I don't want to say the wrong thing, but it's ranked pretty high as far as where unemployment is right now. And those are factors that influence everything from jobs to daycare programs to schooling. So that's one of the factors as far as the disparity is the economy. And people will tend to put healthcare on the back burner if they need groceries or if they need to get their grandbaby to the child care center, that type of thing. So that's one of the things South Carolina is dealing with. And again, with jobs being, unemployment being as high of a rate that it is, people are choosing to do other things rather than go to the doctor. So the challenges I'm facing is that even if I cannot help to offer assistance to pay for screening, we want to at least offer the education so that they can be aware of what they're facing or what it is that they're dealing with. And if I cannot assist them, which I have in the past monetarily, to have the resources available to and guide them to go somewhere else, or at least a resource available to them.
What are some of your advocacy initiatives through your work at Clemson and also as an independent advocate?
Through Clemson, I am considered a program coordinator for several coalitions in the upstate. Initially, when I went to the university, I came under a grant that was only supposed to last a year, that was only have a year left on it. And it started out with SALIC, which is the Southern Appalachian Leadership Initiative on Cancer, and it ran through 9 states, beginning in Pennsylvania and running all the way to the mountains of Georgia. And there were 3 of us that in our area that covered a 3-state area as well as 3 universities, which were North Carolina State University, Clemson University, and University of Georgia. But we all also held the position of state coordinators for our state. Here it is 14 years later, and I'm still here doing what I'm doing. We've screened rare and never seen women in breast and cervical cancer. The money ran out, and I had to become creative, so I created a golf tournament, twofold golf tournament. It was an educational fundraiser. And there were 3 coalitions that I oversaw, as well as in the upstate of South Carolina, 3 counties. And if we raised $25,000, each one of those coalitions would receive a check because they were out there in the trenches, and the money would assist women with screening, biopsies, medicines, and this has gone on for a long time. Again, as under working for Clemson University, I've been able to partner now along with entities such as SSP. And there's funding out there. Live Strong, I've done some things with Live Strong. They have a program now that they're preparing to do called Super Siblings, where they want to do programs with parents that have a child that may have had cancer, and the sibling get to be more familiar with what the other sibling is going through. So I'm applying for that. I also train volunteers using cancer as a platform. I have a lot of volunteers that have come to work for the program, and I wanted to have something to teach them about, and I used cancer. Once you recruit volunteers, sometimes it's hard to retain them unless you have something to pique their interest. We've been able to visit the state capitol, see how bills and laws are passed, meet their congressmen, and try to give them talking points. We've gone to lobbying day. Needless to say, I have to take vacation time to do that, but we do that for the state of South Carolina because there's money out there. You just have to try to work to get it. So at the university, I've been able to have a unique position. I act as community liaison between the academia and community. When the School of Public Health, which there's 5 schools under our college: School of Public Health, School of Nursing, School of Education. We have the Export Center, which is a health disparity research program. Then we have collaborative research. If students are looking for a creative inquiry project or a service learning project, they call me. I've sat in on thesis committees for our Master's Leadership Development Program and found them areas that they can go and do studies in what we call red light districts. Are you familiar with that? Mm-hmm. And they're able to go there, and they did a program called Photo Voice to try to see how health disparities and just disparities in general affect red light district communities. So I was able to assist with that.
How have you taken some of the knowledge that you gain at the AACR scientific sessions then to the people that you serve?
To obtain the information, this has been a great conference. It really has, and I'm not just saying that because I'm sitting in front of the camera, but it really has been a great conference. I've been to others, and this has been kind of at your pace. Take the information and you have time to absorb it. You can take notes and go back and ask questions. The oncologist, the medical doctor, all the clinicians have been helpful in assisting with whatever questions we have. And the information that I take, I have to take it and decipher it into a language or verbiage that my constituents can use. They would not be interested in molecular biology, or some of them are not familiar with BRCA1, BRCA2 genes are. But because I know it, then I have to break it down and share with them what they need. When the women and men that I deal with are coming through cancer, or someone in their family, they want to know where do they go to get assistance. At one point in my career working with cancer, I had a young lady that two instances. One particular lady, when you're dealing with chemo, sometimes you can't keep numbers straight in your head. And she was forgetting when her house payment was due, or when her car insurance was due, and she didn't have a support system in place. So we were looking at trying to get the Homeless Coalition to assist her with housing. Her insurance had expired because she didn't remember to pay her car insurance. And then finally some family moved in from somewhere and was able to assist her. So I wear a lot of different hats when it comes to trying to find the resources that cancer patient needs. So back to the molecular biology or BRCA1, BRCA2, when people are getting ready to lose their home, or if they don't have enough money to take care of medicine, they could care less about that kind of stuff. Not saying that it shouldn't be knowledge to me, but when I'm working with my constituents, it's on a grassroots level. They are not able to have funding, or I have funding to bring them to conferences of this type. So what I learn, I have to take it and put it in a language that they understand.
How have you found the Scientist-Survivor program that you're involved with helpful to achieving your advocacy goals?
The information I've learned here and just that are accessible to me through SSP and AACR is a way to continue to train my volunteers. Hopefully one day I'll be able to write a grant where I can bring them all so they can see. In the past I've been involved with ICC and International Cultural Council, and every year I would take a volunteer with me so they can see what I do. But because of the Patient Advocate Program, I can give them information, convey information to them about the importance of what we do. Patient advocacy, because there are still patients that need someone, they don't have a support system to navigate the system. I was sharing in one of the sessions we had this morning, one of the ladies was repeatedly speaking, she was talking about acronyms. She would just call, and I raised my hand to say, everybody in here is not going to tell you that they don't know what those acronyms mean. When you all are talking, I need for you to break that down, even if it's just the one time, to tell them what acronyms mean. Because when you're talking to constituents, they don't know what DOD is, Department of Defense, or DOG. You know, they don't know that. So you've got to speak to them on their level. They're impressed with your credentials. They're impressed with what you all are doing. That's not paying the bills. That's not getting a babysitter. That's not helping them to figure out should they choose between medicine or getting groceries. So those are kind of things that the AACR, I've felt the warmness here. I felt the closeness here. Everybody's personable. I will do from here on out really what I need to do to help AACR advance. I know that I can count on them to continue to get information that I can share in my presentations and in my trainings and workshop with my volunteers. I'm looking forward to that. I usually take them as a culmination at the end of the training. We usually have 4 sessions, and we take them to our state house in South Carolina so that they can understand how a bill is created, how a law is passed, and able to talk intelligently and confidently with their state senators and their congressmen about something that they're passionate about. They have about 2 to 5 minutes to really get a point across. So they have to really be have their stuff together and ready to talk, because they're trying to pass you by if they can do that. So AACR has been good with helping me to prepare my advocates for what they need on a local level.
And what kinds of collaborations emerged from your participation in the Scientist-Survivor program?
Oh gosh, there's been some wonderful connections and some networking. Persons that are working with different types of cancer, survivors. I've been able to call and write and get materials that we, being a grassroots effort, can't afford to buy, but because of my connections, they're like, well, call me. Or either when the kiosks here break down, and if they have extra material, I can have it. And I'm able to take that or ship it back home. And that's priceless for the people, the constituents that I work with, because I'm one person that the municipalities call, especially during Breast Cancer Awareness Month. Do you have anything we can set on the tables? Do you have anything we can put in the employees' packets for October or for September when it's prostate cancer awareness? So what I get in bulk, the city asks for it. We're having a campus-wide recognition day at Clemson, and Clemson has over 20,000 students, and on football day it's 90,000 people in Death Valley. Pink ribbon awareness. So I'm one person that's trying to get the message out for a lot of people. I'm the voice for a lot of people when it comes to cancer.
Marian, thank you so much.
You're welcome.